Hello, I'm Audrey Lisco, principal with the Chartist Group. Today, we're examining the opportunity to develop an advanced engagement center as part of a broader consumer engagement or experience strategy. Yes, as you all well know, digital and online channels are being adopted by healthcare systems and consumers at never before seen rates. However, in the race to get up to speed quickly and meet evolving consumer needs, many healthcare systems are just not paying enough attention to their primary connection point, which remains the good old-fashioned telephone. And sure, they've been answering phones for decades. This isn't new, but it's only become more complicated to do so. Consumers' expectations are higher. There's more options for care and services, which along with that comes more complexity that patients need help navigating. And lastly, as health systems ramp up outbound communications, whether it's part of a consumer engagement strategy or not, the onus shifts to people answering the phone or those on the other side of these electronic forms of communication to translate and coordinate on behalf of their consumers. Now, this may surprise you, but the answer is actually not to start consolidating all your front-end staff into a central building. A critical success factor is to start with a consumer engagement and experience strategy. Decide what your organization aspires to be or offer now, in the near term, and further into the future. The vision and roadmap and the process that you go through to create it will help inform decisions throughout the journey and help to align stakeholders on what the organization is collectively trying to achieve. The vision needs to be balanced between the practical, what do we need to do now to fix our current operations, and the aspirational, with the openness to emerging solutions that can support your overall consumer engagement goals. We believe that a high-performing engagement center will be a requirement to enable your consumer experience and engagement vision. First, what it's not. It's not a building or a team or even a call center. It's a centrally managed, coordinated set of capabilities that connects healthcare consumers with health systems. And in this case, consumers are defined as current patients or families, potential patients, and referring providers who are often seeking care on behalf of patients. Ultimately, the engagement center is critical to building and maintaining long-standing, trusted relationships with these consumers. No matter what channels these consumers choose to engage with the health system, the engagement center can play a key role in navigating them to the appropriate service. Here we've listed a set of functions that are typically included and/or coordinated by an advanced engagement center. The set of services of each organization may look a little different depending on the organizational dynamics and ultimately your individualized consumer engagement and experience vision. These services can be expanded or added, built over time as the engagement center matures. So going through, appointment scheduling and support is typically the most obvious and one that many organizations have centralized to some extent, often with mixed success. Under the clinical services and care navigation bucket, we see a variety of complementary services that include triage, care management, and associated outreach. And in many ways, this function serves as the extension of the care team in the practices, helping with prescription renewals and responding to clinical inquiries. Patient financial management is also increasingly integrated with appointment scheduling to enable streamlined interactions with consumers and ensure that health systems are able to appropriately prepare patients clinically, logistically, and financially. Lastly, the inclusion of referral management services can facilitate a hassle-free experience for referring providers, whether they be internal or external to your organization, and support more timely care for referred patients. The integration of these services, organizing around patients' needs versus legacy functional departments, can enable a powerful, coordinated consumer experience. As we think about embarking on the journey, we've broken it into three major steps: standardization, centralization, and digitization. I'll briefly touch on each of these in subsequent slides, but wanted to make the point that this is often a more iterative process than it is depicted here. You may progress through the cycle for a single function or capability and then restart it for the next. Or you may find, as many do, that for some services, you've already jumped to centralization before standardizing, and you need to go back to standardizing before progressing toward further centralization or digitization. So let's first talk about standardization. Often a dirty word for clinicians in particular, but our experience indicates that standardization done well helps establish the foundation for consistent consumer experience. We think about it in several categories. First, establishing and disseminating a cohesive and compelling case for change instead of common goals across the organization, obviously tied closely to your consumer engagement and experience strategy and vision. Next, taking an inventory of your technology platforms and capabilities and working to create a more cohesive infrastructure across the key functions. Then reporting. It's amazing how many organizations have no data-backed understanding of the volume of and or service levels associated with their phone-based and online consumer interactions across the health system. Getting a robust analytic system in place is critical to managing performance over time. And finally, identifying and seeking to eliminate variation and, quite frankly, unsatisfactory consumer experience across interactions with consumers. Anything from scripts for how to answer the phone, protocols for triage, scheduling, phone transfers, guidelines for outbound patient communication. All of these can be redesigned with the common goal of enhancing consumer experience and creating trusted, long-standing relationships. As we move on to centralization, this is what enables organizations to capitalize on scale by consolidating their operations. It doesn't necessarily mean moving staff into a central place, but it often does mean creating a consistent operating model and oversight structure. This also supports maintaining all the work that you did in the standardization phase. In defining the new operating model, the design process itself is critically important. Ensuring that stakeholders, including providers, are engaged throughout the process and that decisions are made with long-term vision and goals in mind helps mitigate challenges that you may have down the road. Additionally, spending the time and effort to adequately prepare the practices or departments to transition to the new model, making sure they truly understand the impact on their operations is critically important and one that organizations often overlook. And lastly, as the operating model shifts, so too will the relationships and interfaces with supporting functions and sites of care. It's important to put mechanisms in place to ensure that the engagement center is seen as a partner with shared goals rather than a distant corporate function. Finally, stabilization and centralization efforts pave the way for effective digitization, whereby the organization is able to leverage self-service and automation capabilities to reduce costs and enhance convenience for consumers. During this phase, you'll need to take a disciplined approach, whereby technology is selected and are optimized based on business need and then fully adopted. And to generate value out of your technology investments, your processes must be redesigned and hardwired to incorporate the appropriate use of technology and to avoid redundancies and inefficiency. And as more and more solutions emerge in this space, this step will be the most dynamic. It'll require active reevaluation of current and potential technology to ensure that the engagement center is optimizing its resources and able to meet consumer needs and expectations. In the course of working with our clients, we're often asked about the business case, or how do you measure ROI of an engagement center? And while that's a really difficult question to answer generally, because A, most organizations have no concept of what they're spending on these functions today, and because B, the starting point is highly variable across organizations. Our experience indicates that over time, value can be measured across several key drivers. First is your ability to attract and retain consumers, as measured by new visit volumes, keepage, leakage, and even market share. Cost reduction. Though it takes probably the longest to realize, over time, the unit cost per encounter should decrease. supported by efficient operations and by the shift toward only the most complex interactions requiring live staff support. There's also the potential to reduce staff attrition due to enhanced consistency, job aids, and tools for frontline associates. Next is capacity optimization. An enterprise-wide engagement center can enhance your ability to place patients in schedules that may have previously been unfilled due to lack of visibility or oversight. This can improve provider productivity and wait times for patient appointments. Engagement centers can also support population health management through enhanced coordination of care and access. And finally, revenue capture. Consistent optimized processes can lead to more timely payments, registration and authorizations, and ultimately decreased initial denials, avoidable write-offs, and bad debt. This is an important topic for health systems seeking to improve overall consumer experience and engagement. More and more organizations are considering the value of an advanced engagement center from both a strategic and operational perspective. We'd welcome further discussions with you around where your organization is on its journey and how to accelerate or advance your efforts. Thanks for listening.